Doesn't that feel good? Welcome back, entrepreneurs. I am your host, Jason Setzer with the Local Business Podcast. We're talking everything to do with entrepreneurship by sharing stories of success, failure, and everything in between. That sounds like something that you're into. Hang out and enjoy the show. In studio with us today, Sean Dittman.
Oh, hey, all right.
Sean, you want to give everybody the elevator pitch, who you are, what you do, and who you do it to?
I'm Sean Dittman. I am a board-certified family nurse practitioner, and I own and operate Affinity Family Care Clinic in Cibolo, and we do primary care services from babies, newborn babies, to grandmas and grandpas all across the lifespan for primary care and health prevention, and that's what I do.
When did you start Affinity?
Officially was July 2017.
When you say officially, was that when the building was opened, or was
No,
that when you did the Suburban Road Crew?
That was a Suburban Road Crew. Yep, that was the month that we registered with the state.
So tell me a little bit about that. You actually started your practice in your truck.
Yes. Yep. So I was working at WellMed, and at the time I was doing a little extra shifts and stuff to kind of try and pay the bills and things like that.
Uh-huh.
And some of those hours were getting shifted around. And so one day I was talking to my wife, and I said, hey, I think I'm going to get another part-time job. She said, she goes, why don't we just create our own part-time job? And I was like, huh? Okay, what are you talking about? She's like, well, why don't we just make our own? And, we'll see patients on the weekends or something, or in after hours. And then I can be with you, and the kids can be with you, and we'll just do it. So that sparked a afternoon of, okay, how do you do that?
What's involved there?
What do you do? And so I looked into that and, jumped through a couple of hoops and figured out my wife's an LVN. I'm a nurse practitioner. We could do it as a team. So I didn't need an office space. I didn't need nothing. I could keep working for WellMed and do this little side gig, instead of...
Did you have to get a license to do it on the side?
No. So
nothing special?
Well, you've got to register with the state and get a TIN number and all that kind of stuff, and your health insurance and, liability stuff, all of that. Yes, I had to do all that. But there's not like a certain business license that you have to have. So, just register with the state and, put all the ducks in a row and put a advertisement out on Facebook that we would do like house calls. And we got a phone call like within 25 minutes.
Oh, really?
Yeah.
This is great.
Yeah. So I used it was called Grasshopper phone. So it's like a business phone that gets to your cell phone.
Yeah.
So we had that. And then I had the same kind of concept for a fax machine. You could fax through your cell phone. So I had that, and I had a little bag with my stuff. And I had a little electronic medical record that I found that was cheap. It was free, and as cheap as it gets.
Yeah.
And so I knew there were certain irreducible elements that I had to have in order to practice. So I put all those things in order and said, okay, well, let's give this a shot. We went to see a patient. It was actually here in Selma.
Wow.
Yeah, first patient was here in Selma, and took care of him and his family in the house. My wife would go in and kind of do all the medical assistant nurse stuff, take the vital signs, all the information. She would come out and give me all the information. Then I would go in and do whatever I needed to do from I think I had an iPad at the time. And so that began to grow pretty quickly. So one of the patients that we went to go see put out like a pretty nice review, like a shout out.
Nice.
Like, hey, they came to my house. My daughter had strep throat, blah, blah, blah. After that, the phone started ringing like a lot. And so I would go to work at WellMed all day and take care of patients and do my stuff there. And by the time I get home, Amanda would have a list of patients for us to go see in the evening.
Yeah.
And so I'd get home, change clothes, and then get in the Suburban. We'd put the kids in the Suburban, and we would go and see patients. So it got to the point where I was working every night after working all day, and the kids, they're like, "Oh no, we have to get in the Suburban again," and then we'd work Saturdays too. So I had a friend of mine who runs a PT clinic, Derek Sanchez, I think you know him.
I know Derek.
And he was like, "Hey man, you can use my PT clinic, on the weekends when I'm not there." And so that was helpful because
That's huge.
Yeah, it was awesome.
That's huge, man.
Yeah, so he had told me a story how somebody helped him when he was starting a business, let him use a spot for free. And he was like, "I want to return the favor."
Pay forward, yeah.
Yeah, so he was like, "You can see patients in my clinic on the weekends when I'm not there." So we would do that. So we'd give patients opportunities to come to the PT clinic on Saturdays. And I think we worked Sundays. I don't know. It was a big blur.
Sure.
During that time.
It sounds like it's quickly becoming a blur.
It was.
Just explaining it.
And so I'd be at WellMed and taking care of patients, and Amanda would be texting me phone calls and, refill requests. And what do we do about this referral? And I didn't know how to do a referral. Like in school, I come out of the room and I say, "Do this," and it magically gets done. So like Amanda, when the first time we had a referral, I come out and I'm like, "Yeah, so we need to refer to neurosurgery or something, and she's like, "What? How do we do that?" And I'm like, "I don't know, just do it. Figure it out." So she's messaging me and I'm trying to do work, and it was just getting crazy. It was bananas. And so one day we sat down together and I said, "Look," we got to make a decision. We've got to, I've either got to leave WellMed and do this full time, or I'm going to have to stop doing this because I can't do both. And I always make the analogy of WellMed was a great company.
Yeah.
They take very good care of their people. I felt comfortable there. It was like being on a cruise ship. And I had this thought of, okay, I'm going to jump off of my cruise ship that has the future. I've got retirement,
going off in the sunset.
Yeah. You know what I mean? And I'm going to jump off of this cruise ship onto a little lifeboat with sharks all around me, and see if I can make a go of this. And we did. And the way I had it planned out was I was going to leave WellMed on Friday, and I had a schedule full of patients Monday to see in the building. And that was in July. No, June. It was June 28th, something like that. We didn't open until October. So the plan of going from Friday to Monday blew up in the smithereens.
Oh, man.
So, yeah. But from June to October, with peanuts when it come to money, never went without food. My bills got paid. My kids had clothes to wear. My faith was struggling. It's like
tested.
You look at the bank account and you're like, I don't know how we're going to do this. And you're looking at the card from the medical director who I had a exit interview with, who's like, "Hey, if you want to come back, you can always, just give me a call." And I'm like, this was stupid. What are we doing? But we still, we felt good about it. You know what I mean? Not that WellMed was a bad company, because it wasn't.
Right.
But when it's yours, you can do things the way you want to do them. Nobody's telling me, "Oh, hey, I don't want you to prescribe this medication because it's too expensive," or, "I want you to do this. I don't want you to do that." Nobody tells me that.
Right.
If I think this is what you need, I'm going to give it to you.
Right.
Or if I think that's not what you need, I'm not going to give it to you. And I don't have somebody coming in saying, "Hey, giving an argument with me." At the end of the day, the buck stops with me.
Yeah.
So there's autonomy there, and I can treat patients the way I want. I don't have anybody telling me, "Hey, you need to hurry it up." You're spending too much time with certain patients, because some it only takes 5, 10, 15 minutes.
Right.
They need a refill of birth control or something. Everything's going good. Everything out the door, but some, you really got to spend some time with them,
If you're spending your 15 allotted minutes with your patients, right? With a company, and I don't want to use WellMed, but I'm just saying, hypothetical company, versus the amount of time that you elect to spend with them now. Do you think there is a huge amount of cost or money being lost?
So
does that make sense? I kind of dancing all around it. I'm trying not to be insensitive.
No, I understand.
But both sides of the coin.
So the way the medical model in this country is right now, predominantly, is what we call fee-for-service. So you come see me, you have insurance. You got Blue Cross, Blue Shield, whatever. When I sign up with Blue Cross, Blue Shield gives what's called a contracted rate.
When you as a doctor, when you as a health professional signs up with signing up meaning you're allowed to take people with Blue Cross Blue Shield.
Correct. So I have a contract now with Blue Cross Blue Shield.
Oh.
Also, as a nurse practitioner, the reimbursement rate that I get is automatically off the board 15% less than a medical doctor or a doctor of osteopathy, an MD or a DO.
Let's talk about that for a second since you brought it up. You're a nurse practitioner.
Correct.
And so I don't want to get in any trouble, but I always call you doctor. You know what I mean? And I'm sure probably a lot of people do. I know my mom did. I did a little bit of Googling. My niece is a nurse. She's a registered nurse. I told her whenever I first started to go see you that I was seeing, and then I asked her, I was like, hey, what's the difference between a nurse practitioner and a doctor? What do I need to know? And then she works in a hospital, and she goes, well, doctors are dicks. She goes, so you're a good answer. What she was saying is that, in her experience, doctors seem to be more disconnected. They have really poor bedside manner. In her experience, you know what I mean? They seem to be more, I guess, like systematic or like there's like no empathy there for the patient. In terms of schooling, it takes what I read was it takes about 11 years to be a doctor, and it takes about 6.5 to 8 years to be a nurse practitioner.
So to become a physician, you have to have 4 years of undergraduate school.
Okay.
So you get a degree in biology or whatever. So undergraduate degree, pre-med, then you go to medical school. So that's 4 years. So now you have 8 years of college. Then depending on what specialty you want to go into, okay, cardiology, gastroenterology, whatever,
sure,
you'll have 3 to sometimes 6 years of residency training. Okay. Like orthopedics is a longer residency, or neurosurgery is a longer residency than, say, family practice.
Yeah.
So it depends, right? A general practitioner or internal medicine family practitioner will maybe have 3 years of residency. Okay. So you got your 4 of undergrad, your 4 of medical school, and then 3 on top of that. So about 11 years to become a full-fledged physician, ready to go. I'm ready to practice independently. As a nurse practitioner, you got your 4 years of undergraduate in nursing. Normally, like I said, you'll have it was designed, the programs originally were designed for registered nurses that had experience before they went. Now, things are changing now where you can go directly into advanced practice training. In our program, I think there was 60 that we graduated with, and it was like 400 applicants. Nobody in my class had less than 10 years of experience as a registered nurse. Nobody.
Wow.
So we were all very experienced, very seasoned, developed skills. You mentioned, talking to the patient and things like that. As a nurse, you're trained in a nursing model.
Okay.
As a physician, you're trained under a medical model. It's different. Okay, it's different.
And how you talk to the patients?
Yes.
Really?
Well, of course. With a nursing model, you're not so concerned with disease and treatment. Okay?
Okay.
You've got that. You learn the pathophysiology. You learn a lot of these things. But, we take classes like therapeutic communication. Okay, I haven't been to medical school, but I don't think they have that, or touch. Like you do a semester on different touch, the way things feel.
Wow.
Psychosocial, lots of things, and then educating the patients. So there are great physicians who do a very good job
Sure.
at educating the patients on what's going on. But most of that is primarily done by nurses.
I mean, it makes sense. I never realized that there was, I mean, they're two different jobs, right? You got, yeah,
Yes.
That makes sense.
Yes. So then when a nurse goes on for advanced practice training, now you're getting training in diagnosis, right? And interpretation of things. You learn a lot of the aspects of that medical model in nurse practitioner school or advanced practice school, right? So you learn how to diagnose and things like that. But you bring all that other stuff that you learned, all the touchy-feely stuff, you bring that with you. And I think that's what sets nurse practitioners apart.
So I've got a back to the business part of being a health provider. Okay, man, I have so many questions. It's a lot more cut and dry when you're not talking about people's health and business. You know what I mean? So like I've got a couple of businesses, and it does not impact the people the way that your business does. Okay, so but whenever you're talking about the impact that you have with your business and money versus the way my business impacts people and money, it's way further disconnected. If you don't want my service, whatever, no big deal. But I mean, people need to be seen. People need to have, health issues. So that's, man, I try to wrap my head around a lot of different businesses. Being a restaurant owner or a healthcare provider seems to be the top two most stressful things, because you got to get paid, you got to eat. You know what I mean? And so I have a hard time just with my own businesses in terms of, if a customer was unhappy, or if for whatever reasons, you give them a concession or whatever. But I mean, it's like, you've got to be able to take some of your emotion out of your customers. You know what I mean? And I'm calling them customers on purpose, and they're patients, because, you know what I mean? You got a big heart. You want to help everybody. You know what I mean? How do you do that? How?
So when I've worked for other people, I don't have to worry about that.
Sure.
Right?
Yeah, you're an employee, essentially.
I'm an employee. I got the patient in front of me. It doesn't matter to me what they've paid. I don't even know.
Right.
But when now all of a sudden I've got to, everything that I do, and everything comes into that clinic, literally from the floors to the light bulbs, come out of that amount, right? And paying the salaries of those who work with me. So we had to figure some out. And the way, I've talked to her, I said, listen, we need to write some policies, right? And then that's the policy. Now we may have come up with it, and it might change.
Sure.
But at least we've got something to look at and say, all right, so our heart's tugging this way, but this is what the policy says. Right. And try to be fair.
Sure.
So we came up with a policy that if you couldn't pay, you had to at least pay half.
Sure.
And if you have a balance, pay something.
Sure.
Towards the balance. We can't just keep racking it up. Because I had a patient racked up about a $1,000 bill, and then when I said, we got to collect something, they just never came back.
Looking back, if you were going to do this all over again, when it comes to the business side of things, that doesn't do with healthcare. The business side of things, would you do it the same way?
No.
What would you do different?
First thing I would have done different is I would have spent more time on drawing the design of our space.
Oh, okay.
Because
your office space,
office space.
Okay.
So that was one thing I knew nothing about, was leasing a space, right? So you're like, okay, well, let's go lease a space, and you look and it's a shell. And then you're like, okay, well, what do you do? And they're like, well, you build it. Well, okay, who pays for that? You.
Yeah. And you have to design it.
And you got to design it. You got to pay for that. And everything, right? And then when it breaks, you got to pay for that too. So it was a huge eye-opener to me just to get a spot.
Yeah.
How much money it takes to do that, And I'm like, I need to own a building. That's what I need. I need a bunch of buildings with spaces that are shells. And I need to tell the people, hey, this is how much it costs for rent. Build it. Yeah. So anyway, I would do that because I had no idea when it came to a design what I needed because I'd never done it.
Yeah. Mm-hmm.
I've worked in offices before, but it was all there.
Right. Well, and then too, I can imagine, right? So now that you're tasked with this, design your own place, you got to probably take back what you've learned or where you've been working. I mean, okay, well, everybody usually meets in them, there's, well, okay, and then my space looks like an L, so how do I...
Exactly. So I think that I would have spent more time knowing what I know now, maximizing the space that I have, because I'm out of space now.
Yeah.
And I think
Can
if
you
I
kick
would...
the wine people out next to you?
Yeah. No, they're great people. So, it's like I could have maximized it a little bit better, So I would have done that. I definitely would have done the house thing, but I would have liked to be able to figure out how to keep that going.
The house thing.
Going to houses.
Visiting people.
Mm-hmm. Yeah, and that's something that I've tried to add on still now. Like I have a contract with Shirts EMS.
Yep.
That I'm able to send at least a paramedic to the house in a non-emergent vehicle, non-emergent clothes that kind of goes and be my eyes and ears in the home.
Yep.
And then we do a FaceTime. So I like that. I like the convenience of the home model. You can spend more time with patients in their home. So I think I would try to keep something like that going a little bit better.
So when you opened your building, you just stopped the home care?
No.
Okay.
No, I did after a while. Once the building, I started stacking up the schedule.
Yeah.
Then I just didn't have time.
At this point in your career in your business, you don't want to go to a cash model because of your established clientele or just the raw numbers of people in the area?
Because right now I feel like, we have about 6,000 patients in county. I feel like we're making an impact,
okay.
And I feel like we're making an impact. I didn't open Affinity Family Care to become rich.
Sure.
I opened it because I wanted autonomy. I wanted to be able to take care of patients, and I was tired of seeing patients treated, myself included, my family included, like a number.
Yeah.
Like you didn't matter. That's why we chose the name Affinity. I feel like if I was to tomorrow wake up and say, you know what, I'm going to do a cash-only practice, I don't think I could bear that emotionally.
Because of the people that you wouldn't be able to see. Okay. Wow.
And that's just a raw, honest answer, man. I mean, if the reimbursement keeps going down,
there's going to be no choice. Option. Yeah. Yeah. There's good. Yeah.
I have no choice. But it's like a monster, right? This little machine you build, because once you're in it, once you have insurance, now I have to pay someone to do prior authorizations.
Red tape. You got all the.
I got to pay someone to do the billing. I got to pay someone to follow up with these claims. I got to pay. So there's more people I have to hire, which then cuts more and more into the margin.
And also, you probably have had much better luck at it than me, but whenever I hire employees, sometimes it takes a few to get the right one.
We made some mistakes. You asked, you asked about would I do things differently? I think that I think I would have done a little bit more thinking and contemplating about who I hire and when I hire them and why I hire them.
Yeah.
We've learned with each employee, we've had some come and some go. But, a good friend of mine told me, don't ever hire someone you can't fire.
Yeah.
And so when you hire people that's close to you or know you, and you have a relationship outside, it makes it difficult sometimes. It can put a strain on the business. Sometimes, you got to have that disconnect. So after each person I've hired, I've learned a lot.
Yeah.
And the type of person I'm looking for.
Sure.
I'm not looking to me, and I've seen this. You can be the greatest healthcare provider, right? And people could absolutely love you, but your staff can destroy you.
Yes.
If they are not polite, they're not friendly, they're not empathetic, they don't have a smile, they don't
screw up the billing.
Right. Yeah. And even screwing up the billing, people, of course, a huge bill, you're in trouble, right? But for the most part, that's not what makes people go away. Because they didn't feel heard.
Mm-hmm.
They can't get anyone to call them back.
Mm-hmm.
You know, or somebody was just downright rude to them when they came in.
This can be applied to every business. This isn't just your
Right.
healthcare, you know.
Yeah.
But yeah, no, you're exactly right on all those things. I mean, we've experienced them here.
Mhm.
You know when people are pissed because of one of those three reasons is the most common. What would you say is the biggest mistake you've made as a nurse practitioner?
Continuing to try and help in a situation where I was no longer helpful.
Yeah.
So, go ahead.
When you say when you're no longer helpful, is that?
So, essentially, in a situation, you may have a patient that's dealing with something that I cannot fix.
Okay.
It's not a medical problem. It may be a psychological problem. And so I'm trying to have that balance of, okay, we're going to continue to investigate this.
Sure.
To a point where I know, okay, we've investigated this. This is not what you think it is, but still trying to be kind and placate to that.
Sure.
Instead of saying, no,
this is not it.
This is where the buck stops. It stops here. You know, I'm going to get you in contact with some other, professionals. You can go down this route, but this is where the investigation stops. Because now we're just wasting your time, your money. We're doing all these tests
at this point for no reason.
Right. And so I think that I forgot how my friend phrased it, but saying no at the appropriate time has been you asked, the biggest mistake I would say is not speaking up and saying no at the appropriate time. Instead, letting it drag on a little bit.
How often do you think you make the mistake?
I know of one time specifically I've made that mistake. Probably blur the line. Sure. Probably often, because you got to be delicate.
Yeah.
There are things, and I know the world with the internet and so on and so forth, and I encourage patients to look at things and read things.
Except for WebMD. Do not go to WebMD.
In any profession, right, it takes years to become proficient and to become an expert at something. And so there are times where you have to be delicate with the patient in explaining to them, basically, they don't know what the heck they're talking about.
Right.
Without saying that in a way that's offensive, because their intention, at least for the most part, is good.
Right.
They want to feel better. They want answers. They want information, and so it comes where if they become argumentative, they may not actually be trying to argue with you being mean.
Right.
It's more of a passion because they want to get better, and so you have to take that, listen to that, filter that, eat the fish and spit out the bones. But there does come a time where you have to tell them, no, you're just wrong. It's just not true.
Right.
This is not what's
We've
going on.
done everything I know how to do.
Mm-hmm. It's
if
time
you
to
want to
move
continue
on.
this, you're going to have to go somewhere else.
Time to move on. Yeah. And I'm getting better at that. A friend of mine says she breaks up with patients when she needs to.
Yeah.
And I have, I've been very, not very easily doing that.
Well, yeah. I mean, there's in business, you can fire your customer. And it's sometimes, I don't want to speak for you, but for me, sometimes that is a very satisfying feeling.
Yeah.
But
first patient I had to fire, she got mad because she essentially wanted me to write a prescription for marijuana.
Oh.
Okay. And so
in Texas, you can do that?
In Texas, there's something called a compassionate use program. And there are certain diagnoses that I can certify and get them approved. I have a partnership with a physician who's a physician certified to prescribe cannabis. Mm-hmm. Okay. So you can come through me, but there's only certain diagnoses that qualify. Mm-hmm. Okay. And so, of course, she didn't have any of these diagnoses. And she got upset with me because literally the Google review says I would not tell her who the dope man was in the city because she was new. She was from New Orleans.
You have a Google review that says I would not tell you. Oh, that
wouldn't tell me who the dope man was.
Oh my! Yeah.
So I had to fire her.
Oh,
So that's an extreme example, but But to answer your question, the biggest mistake sometimes is letting things go on longer than they should.
What's the best advice you've ever received?
Be present. Be present. And make a practice of being present. It's a simple thing,
Well, it's
but
simple said.
It's not very easy, right? Especially today. Our attention span is 10 seconds on the reel, TikTok or whatever it is, Instagram. So often we miss what's going on, and especially in my job, I've got to be present each patient encounter. And it's hard to do sometimes. Like I said, you can have one patient that needs a refill of birth control, everything's going fine. The very next patient's a 12-year-old contemplating suicide.
God.
And then the patient right after that's 84-year-old with heart failure. And the next patient after that, is hormonal imbalance, So you got to shift gears. Before I walk out of one room and into the next room, I could have a lot going on in my mind,
right,
and in my soul, really, in my emotions. It may be a patient I've taken care of for a long time that's been stable on their mental health medication, and now they're struggling, and I'm worried, and it's the weekend, but now I got to shift gears because I got Miss Jones next, and so being present in the moment, I think, is the best advice people have given me.
Suicide is scary as hell for me because I've never went down this journey, you know what I mean, or this path in my head. I've never thought that was an answer for me. Okay. And then I've often thought about, not often, but I mean, I think about, whenever you hear about suicide and, it's affected me, some friends and family, stuff like that. I think, what would it take for me to get to there? And I'm thinking that not in I want to get there part, but I'm just like, what would push me to that, And man, I gotta tell you, I've come up with some really dark shit to get me there, and I'm very fortunate that I've never been close to that dark shit. Okay, so to hear about children that are battling with suicide, man, that is horrible. That sucks.
Yeah, it is. It does suck.
And so
there was just
how often do you deal with something like that?
There was just two kids at Steele High School that killed themselves in the last year. So it happens. With kids, it's a little different than adults. Kids are more impulsive. Sometimes
end of the world type thinking.
Well, sometimes you're not dealing with, say, a clinical depression. Sometimes you are.
Yeah.
But sometimes you're dealing with a reaction, and kids sometimes either have shame, they're feeling shame, or they're feeling anger. Like, I hate my parents, so I'm going to get back at them. Or my girlfriend cheated on me, and so I'm going to get back at her by taking my own life. That'll show them. This will make people look at me. This will make people see that I'm hurting. And it's an impulse. It's a split decision most of the time. It's not really like planned, thought out, planned out. As you see with a lot of adults, like an average 54-year-old male with chronic clinical depression will contemplate this for a while and can make plans and actually begin to feel better right before they do it. Because they've made peace that this is going to happen, that sort of thing. So it's a horrible thing. Mental health in general in this country we got to do something better. We really do. And I don't know what the answer is. You've got the school doing their thing, trying to help out. You've got, healthcare providers. We try to do our thing, and then there's a lot of stuff that goes on at home too, and it's, kids in general talking. I had my own I've got teenagers. What'd you do at school today? Nothing. Or I learned. How's it going? Good.
Well,
so getting them to talk.
Getting them to talk, right? But public school, just in itself, I mean, like, I went to this little bitty podunk school in Lavernia. At the time, it was a little podunk. I think there was 100 people that graduated, something along those lines. I was like right down the middle, just head down. You know what I mean? And it's not that I was afraid of it, but my point here, before I get a little weird, my point is just that school is tough.
Oh, yeah.
It is tough for an adult. if you put an adult in that situation, it's going to be awkward. It's going to be weird.
Yep.
You're going to get through it. You know,
Yep.
but this is kind of weird. Now you add being a kid.
Yeah.
You know, learning all these things and emotions and feelings and all this stuff for the first time in a prison yard, essentially.
Yeah.
You know, it's like
Lord of the Flies.
Good Lord, how do you get through it? And then you add on top of all the social media and, you know, once somebody hits record, it's never gone, ever. It's never gone.
Yep.
You know, and then like you said, with kids being impulsive, the amount of suicide that affects kids, do you think that is majorly impulsive?
I do.
Okay.
Absolutely. Yeah. Yeah, the frontal cortex in the brain is not fully developed. There's debates between the ages of 22 and 25 years old. That's where a lot of the impulsive, emotional decisions come from. You know, that's the insurance companies know this. That's why your insurance goes down at 25, not at 18.
Right.
And so, yeah, absolutely, most of it is impulsive. Now, of course, there's all kinds of in-betweens there, right? And what I try to teach parents, even my adult patients that have mental health issues, and the kids themselves, is your brain is separate from the mind. Okay, your brain creates the mind.
Okay.
And so sometimes I'll have kids tell me, I'm not anxious, and they're twibbling or flipping around, you know, and the heart's pounding, their blood rushes through the roof. What am I anxious about? I'm not anxious about anything. And I'm like, you got to understand, your mind.
You're making me anxious.
You're telling yourself this, right? In your mind, you're having this conversation. I'm not anxious. I'm not scared about anything, right? But physiologically, you're having a sympathetic nervous system response, right? It's how people go to the emergency room. They think they're having a heart attack, and they get insulted when you tell them your diagnosis is a panic attack or anxiety. They're like, I don't have anxiety. I am having a heart attack. And you're like, no, you're not. You feel like you are because you're sympathetic. That fight or flight is engaged. And you can't just flip a switch.
Let's switch gears here. We're a little bit halfway in. Pick a color. Black, green, blue, or red?
Green's my favorite color.
Green is your favorite color.
Irish.
So do you know what we're going to do here?
I do not.
So these are called pod decks. I'm going to shuffle it up here because...
Did you say pod dicks?
Pod decks.
Okay. It's like,
what kind of show are we doing
here, Jason?
Doors closed. You got the cameras on. I didn't know we were going to sign up for this.
Yeah.
So what's going to happen here is I'm going to ask you, these are just, let's see here, 3, 4, 5. This is the lightning round. I should have started with that. Lightning round is, I'm going to ask you 5 questions off of the deck of cards that you just picked. They have nothing to do with healthcare. They have nothing to do with business. They're just 5 random questions. You answer them however you want to answer them. And just remember, you pick the deck.
Got it.
So question number 1. Would you ever pick up a hitchhiker? I have. Yeah.
Mm-hmm.
Okay.
Now he goes in the back of the bed of the truck. I'll give you a ride, but you're not getting close to me, buddy.
Yeah, you're not going to get within grabbing distance. Yeah. Where'd you take him?
Up the road.
Yeah.
He needed a ride to the gas station.
Oh, nice.
Yeah. So it also depends on if my family's in the car. You know, there's some depending things there.
Have you ever licked a battery?
Oh, absolutely. Yeah, in fact, like a week ago to see if it was dead.
Battery testers, who needs them?
Yeah.
What Guinness World Record do you think you could break in the future?
Oh, man. Guinness Book World.
Guinness World Record. That's
a hard one.
Then they're getting really weird subjects too, right? It's like, I never thought that would, I can't think of any right now.
Yeah, I don't know.
Like twirling plates, like...
Yeah, they told me the other day, my son said someone did a plank for like 5 days.
Oh my God.
Yeah, some crazy thing like that, So I'm like, I don't know, man. World records, you're the top.
Right?
I'd have to think about that. I'm not sure.
How fast can you say the alphabet?
Pretty fast.
Do it.
A, B, C, D, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, V, X, Y, Z. I skipped a bunch.
W, X, you missed the W, X. Do you have a birthmark? And if so, where?
I do. It's on my calf muscle.
Oh, yeah? Interesting. That was the lightning round.
There's this huge stigma on mental health.
Mm-hmm.
Because you have a brain maybe that's not functioning correctly, that's causing the mind to be dysfunctional.
Okay.
Like in depression, right? You got these negative thoughts. Nothing's ever going to get better. Nothing's ever going to improve. Nobody understands me. and you get this negative cycle going on in your mind. The only way out is death. The only way to feel better, is being locked in a room with the door open, but you can't get out.
Wow.
Everyone out there is out there, but you just can't get out no matter what you do. Or you're in a room full of people that can breathe and you're suffocating and you can't breathe. And people look at you and say, well, just breathe.
Yeah, yeah.
Or your parents will look at you and say, well, just
be
breathe.
happy.
Just be happy. Or, you can't do that when your brain's a little dysfunctional. And it could be, chemical imbalances. There's lots of different theories out there of what could be causing it.
Mm-hmm.
That's why mental health really, when you come to my practice, is going to be more of a holistic approach. And I tell this to parents all the time. They come in, my kid needs meds. No. We're not going to start there. Okay. First of all, the meds can potentially make him worse,
right,
or make her worse,
mm-hmm.
right? There's a huge black box warning on all these meds.
SSRIs,
that can
SSI,
increase suicidal ideation,
mm-hmm.
right? So it's a holistic approach. If your diet's poor because you're eating nothing but processed foods, right? You're a kid and you're at soccer, you're at baseball, you're at band, you're at karate. Okay, and you have homework.
Living on ramen noodles.
Okay, and you're living on Cane's chicken because you're busy 6 days a week,
mm-hmm.
right? Your brain's not developing correctly. You're not getting the proper nutrients, right? And so micronutriently, you're deficient. Things like magnesium,
mm-hmm.
which is a natural relaxant. Okay, muscle relaxer, it helps with anxiety. Intracellular deficiency of magnesium's through the roof. Right? And so you come to my...
Through the roof with just people in general? Or?
Yes. Oh, yeah. So you do a magnesium in the blood.
Okay.
Comes back normal, between 2, 4. But you do an intracellular magnesium, and RBC magnesium is low. How's that? How can that be?
What's the difference?
Well, intracellular magnesium, the magnesium in the cells is functioning different than if it's just floating around the bloodstream. It's actually being used in the cell.
So where it's being used, there's a deficiency?
Yes.
Now I'm curious.
Mm-hmm.
So how do you have that situation?
Because you might be, again, when you're dealing with lab references.
Yep.
Says you're normal.
Mm-hmm.
Okay, in the blood, in the serum, but then you have an intracellular deficiency because your diet is poor. It's not good.
Mm-hmm.
You're not eating green leafy vegetables, foliage. That's where you get a lot of magnesium from. How
can it be right in the blood and not in the cells?
It just can be.
Wow. And usually the cause
it's a different compartment.
A diet is to blame for
and
that.
Especially the brain. So, like, people take a magnesium supplement.
Mm-hmm.
There's a blood-brain barrier.
Mm-hmm.
A lot of that magnesium that you take as a supplement doesn't get to your brain. So the cells in your brain that need the magnesium the most isn't getting it. So then you have to get a formulation of magnesium that will cross the blood-brain barrier.
That's why nootropics are so popular, right? Because it crosses.
They're very popular. So again, proper nutrition, first of all, is where we need to start. Because most teenage kids, and it's a struggle in my household. I'm an American family like anybody else,
Mm-hmm.
But you got to start somewhere.
Isn't it amazing the shit food is so much cheaper than
horrible.
the stuff that's good for you?
It's criminal, man. It's so bad. There's so many things that are like legal in this country that are illegal in other countries that we eat.
Yeah.
And I tell this to patients. I mean, look, they get these chemists, these bright minds, and they tell them, hey, all you got to do is come up with a chemical that won't kill you right away, make you highly addicted, and, we're going to give you bonuses, and we're going to put it in the food.
Or, health.
So, for instance, I've had kids that come in and they're anxious, they're depressed. You talk to them about their sleep. What time you go to bed? Oh, I don't have a bedtime. Oh, okay. Mom, Dad, there's no bedtime. So we're up on TikTok till 1 a.m. Then we wake them up at 5:30, and then they go to school all day and then they have band practice, right? What'd you eat yesterday? Nothing for breakfast, right? So a lot of kids are skipping breakfast. What'd you eat at lunch? There was nothing at lunch. I had some fries, Okay, what'd you have before you came into the appointment today? A bag of Takis. Okay? I got to look over the parents and say, listen, we're not going to start with psychotropic medication. Okay, we need to sleep.
I don't mean to laugh.
We need to eat right. We need to drink water, and we need to exercise, and we need to not be so busy.
Mm-hmm.
And I think a lot of parents' intentions are good.
Sure.
They want their kids to be involved, and, studies have shown if they're involved, they're less likely to participate in sex and drugs and things like that. But there's got to be a balance.
Yeah.
There's something to be said about sitting around a table as a family.
Mm-hmm.
that we don't do anymore. There's studies that have been done to show it reduces anxiety and depression, makes you feel included.
Yeah.
Even if, it's just for a minute. Hey, what went well today? What did not go well today? Everything. It just gives them an opportunity, that someone's hearing what I'm saying.
Yeah.
Because there's a lot of households where there's not. Mom and dad are both working till 8 o'clock, after traffic. Who wants to cook after that?
Yeah.
Right? So you throw whatever trash you can on the table. Everybody takes their stuff and their phone and they go to their respective place, and that's family dinner.
Yeah.
And we wonder, why do we have such a mental health crisis among adolescents? I think it's a breakdown of simple things that grandma told us to do.
Right. Yeah. I mean, they did us well for many years.
Now, sometimes medicine can be life-changing, can be life-saving. I've seen it. And it takes time. How do you do that with an adolescent that's struggling, doesn't want to talk anyway, and the insurance company tells me I got 15 minutes to figure this all out? And
we may or may not pay you.
Yeah.
I know that's not even a concern of you, but for me in business and trying to keep the lights on, here's this very complex problem. We may or may not pay you for it. How many of these can you see in a day?
So you try to do it holistically, and I think that's the approach that needs to be done. Mental health, medications have a place, but most people don't know 1/3 of medications for depression and anxiety work. It means 2/3 don't.
Right.
So it's not, eureka, we got a cure here.
We discussed that NPs get charged, or that they get paid from 15% less than physicians right off the bat.
Right off the bat.
But does your practice charge more or less than a physician's?
No. My practice, so this is where the insurance company comes in, right? Let's say, for instance, you come in to see me, you have Blue Cross Blue Shield, and you have a deductible. Okay? You have to pay everything until that deductible is met. Okay? Now, Blue Cross Blue Shield has a contracted rate for me at $70. Okay? So you come to see me, and I don't even get to make up how much I charge you. I have to charge you the contracted rate that Blue Cross Blue Shield says. $70, because you have to pay that until your deductible is met. It's not a copay, it's a deductible. Okay, so you pay me $70 to see me, and you do that every single time until your deductible is met. Now, if you go see Dr. Jones down the road, Dr. Jones has a contracted rate with Blue Cross Blue Shield for the same code. His is 15% more than mine. So you're going to pay him more than you would pay me. So it is cheaper to come see a nurse practitioner.
At your cost.
At my cost. Yes. Yes. I eat that.
Sorry about that.
Yeah. So the insurance company it's better for them, for their people to see me.
Okay.
Financially, it's better for them.
That is a wildly difficult path to navigate. I don't even, that's frustrating as hell.
It is.
My thing is this, is that if you have a product, right, and if your product is the best on the market, you're going to get the lion's share of market, right? So if your restaurant is putting out the best food 100% of the time, every single night, which we all know doesn't happen, your customer still has to be in the mood for it. You see what I'm saying? So I always throw out the restaurant as a really stressful business because of that reason, right? Now we talk about healthcare. We talk about there's just a whole new level of stress. Because at least with the restaurant, you know what your damn costs are. You know what you can decide what the menu says, how much people are going to pay. You just got to hope they come in every night. You know?
Yep.
Jesus, man.
Yep. And the other thing that's scary is if Blue Cross Blue Shield woke up tomorrow and decided to break my contract. There goes a lot of my income.
They can break your contract.
Yeah.
Can you break their contract?
I can.
Yeah.
I can say I'm not accepting them patients anymore.
Yeah.
But like what I'm saying, if
Keep
they
happen.
if they put you out of network,
well then yeah, that's the whole.
The patient's going to have to pay out of pocket.
Well, then usually what'll happen? What do I know? But that conversation seems to always come up whenever you're looking for somebody new. Are they in network? You know, and if you're not, then okay, well, who is in network? You know, you just got looked over. You know, that's You
know, going back to your comment where you said you were that guy that, you know, you're young, fairly healthy. It's a big deal for me for people like that demographic. I've had a lot of patients that have come in reluctantly, drug in by their wife, you know, sometimes by their parents. But most of the time it's the wife that, you know, you go or else type of thing.
Yeah, that's very familiar for me.
And they sit down and right off the bat they tell me, I hate being here. I don't like you. You know, like I don't want anything you have to say. It really, I have a heart for that person.
Yeah.
Because prevention is so big. Most of the time, just, you know, there's outliers, but most of the time this is your guy who is a blue collar worker. You know, he works in the oil field. He's got 3 or 4 kids. You know, he works 65 hours a week. You know, maybe drinks a little bit on the weekend. He's stressed out. He's depressed, but wouldn't tell anybody. You know, this kind of guy. Or doesn't know, right? Fish doesn't know he's wet.
Right.
And so
that's a great analogy.
And so I really try to focus in on that person to tell him, look, I'm not looking to scare you. I'm not looking to, you know, come down on you, lecture you. That's another thing, you know, like.
Yeah, that's a big thing I think people don't want to hear.
Right. And you know, what I want to know is, are you healthy so that you can continue to do what you do for your family? You know, because I've had patients that are that 43-year-old guy, you know, is a little bit overweight, hardworking guy, and, you know, the wife's trying to get him to come in and not come in and not come in, and the wife comes in and you shut the door and she starts crying. What happened? And my husband had died of a heart attack in his sleep last week. You know, and he had no life insurance. You know, and it's like, man, you know.
Now what are we going to do?
Yeah, and so it happens, and people don't think it's going to happen, and it's just devastating to a young family. You know, or the mom, you know, same thing, dies unacceptably or has a stroke or, you know, something like that. So something that's preventable, something that we can find, you know, high blood pressure is called the silent killer. People tell me all the time, well, I don't have high blood pressure. I feel fine. Like,
just doesn't know he's what.
Well, yeah, you feel fine because there's no symptoms. Your blood, you got 160 over 110 right now. You could have a stroke.
Yeah.
You know, and you didn't know it. And it's over time that you will develop left ventricular hypertrophy. Your heart's going to get stiff because it's been contracting. This muscle's been contracting into a high pressure system. Same concept as your bicep. If you're doing a dumbbell, the bicep's going to grow. And it can be avoided. We got to check.
Data, man.
So I tell dads this, you know, or anybody, just come in once a year. You know, get a physical. You know.
So my brain instantly, you said physical, instantly goes back to high school. Getting all the
cough and turn. And
you know what? Yeah, I think that's a big thing, right?
Yeah, it's true. People don't know what a physical is.
Right. You know, it's a lot more than just seeing if you got a hernia, man.
Yeah.
You know?
Yeah. Well, I had a woman the other day. I said, when's the last time you had a physical? She goes, oh, I saw my GYN a year ago. I'm like, that's not a physical. She's like, well, that's my physical, right? Like my annual pap smear. I'm like, no. It's not a physical. GYNs are great. I love them. They do fantastic work, but they're not primary care providers.
Right. What's going on in the community right now in our area that people should be like on the lookout for? I've been reading that it looks like the coronavirus is making a comeback, I guess, or a new strand or something like that.
Yeah. So the Omicron variant is predominantly the variant that's out right now. Okay. And it's been that way for quite a long time. And so since that variant, viruses over time, as they mutate, most of the time, generally, they'll become less and less and less deadly because the deadliest viruses die with the host that it kills.
I remember you showing me this on a chart and how, how a virus, it's,
There was a spike.
Yeah.
And yet when we looked at South Africa, that's where Omicron was first discovered, and how it shot way up and then came way down. And what that's shown is that it went through the population. At the same time, the death rate did not go up.
Right.
So it's shown that this variant had mutated in enough places that it had immune escape, which means that the vaccine was worthless. And if you had a previous infection, natural immunity was a lot weaker too. So you could contract the virus even though you had it before. Whereas before the first couple of alpha and delta, we didn't see that. We didn't see immune escape. If you had a previous infection, you were protected. Okay, and the same thing with like SARS-CoV-1. There was evidence that protected for about 3 years. So originally, that's what people were thinking. I know the news was saying, 3 months, 90 days. BS. That did not happen until Omicron. Okay, and that was a couple of years into this deal.
Yeah.
Okay, so Omicron is then mutated, right? And you got the BA.5 and so on and so forth. This new one is essentially the same as Omicron. It's mutated in a few areas. It's highly contagious. Okay, the affinity is there. It's highly contagious, but it's not producing more than your average upper respiratory cold.
Cold.
Right. So this variant is much different than the original. The original preferred a more warmer environment. So it was going further into the lungs, warmer into the core of the body, attaching to the ACE2 receptors, which we have a lot of those in the lungs. So that's why people were having this cascade of inflammatory mediators and stuff attacking in the lungs and so on, and they die. This one's staying more upper respiratory. It's a little cooler, causing much of the same symptoms as a human coronavirus would do. Okay. I haven't seen a positive test in weeks.
Of any?
Of COVID at all.
Of any COVID?
None. Zero.
Okay.
Yeah, weeks. Now, I'm seeing flu. Every other person's got the damn flu.
So
every day. I had a bunch today, a bunch yesterday, a bunch the day before.
Wash your hands.
You wash your hands. Definitely. Definitely. Get your vitamin D level up.
So is that, let's see, we're in December and it's just now starting to cool off. Is that the main thing that you're seeing in your
Is the
clinic?
flu right now, yeah.
Is the flu?
Is the flu. Yeah. I've had a few RSV cases, which you're going to see in the fall and winter anyway, for kids, but everybody's got the flu right now. Nobody's got COVID right now.
Is it any better or worse than it normally is?
Well,
when you subtract the
what's
COVID aspect?
very, very interesting to me is the, and I don't really have any theory here other than we were wearing masks, schools, the flu predominantly starts in schools and spreads out from there. Okay.
Population.
But I can tell you that for the entire 2020 and majority of 2021, I didn't have one flu case.
Well, and so like when COVID first came out, one of the things that we looked at was how much the flu actually kills people every year.
Yep.
That's a pretty high number.
So since data has been documented, it's roughly around 30,000 annual deaths of influenza in this country. And it's been that way. Hasn't changed. Sometimes a little more, sometimes a little less, but it's about 30,000. Again, during COVID, the height of COVID, I had no flu cases.
Wow.
I really can't explain that other than the mitigation efforts. I don't believe, and trust me, I got half a tin foil hot, I don't believe that there was some kind of switcheroo going on and Corona was testing, or flu was testing for Corona. Number one, they had different symptomatologies.
I got you. That's what you're saying. Yeah.
Clinical picture is different in influenza than it was in COVID.
You can't fake it.
No, and the other thing is when you see people, I can spot someone who has a flu across the room. I could do the same thing with COVID. I could diagnose them before they came in the door.
Really?
Because I saw it so much.
Okay.
Yeah. Oh yeah, the characteristics, their symptoms, the way they felt, the way they looked, the way they're breathing. Remember, all day long I look at people.
So wash your hands. The flu at our local community here in
Definitely.
The shirt Cibolo.
Flu is rampant. Now, flu is self-limiting. What does that mean? It typically just goes away. Like you have your 4 or 5 days of feeling like crap and you get better.
Mm-hmm.
You know, it's nothing to freak out about. Now, do some people get very sick? Yes, they do.
Sure.
Absolutely.
Yeah, like you said.
Just like people don't know it, but there's been people who died from a cold.
Yeah.
Every year, people die from a rhinovirus. You know, and so flu, the biggest thing about flu is how bad you feel and missing work.
Mm-hmm.
You feel like crap and you don't go to work or school. So there's a huge economical, involvement there with the flu. The best thing I think you can do to help with that is make sure you have a good, robust immune system. How do you do that? You exercise. You get good sleep. You eat food. Like food, okay? Fruits and vegetables, okay?
Not a chemical science project?
No, grass-fed meats and, pasture-raised chickens and eggs, like food. And vitamin D is one of the most important things, in my opinion. I check all my patients. People say, why do you routinely check vitamin D? Because I think it's that important.
Yeah.
It has multiple factors. And in fact, I think it acts as a hormone in your body more than it does a vitamin. Most vitamins you get from food sources. You don't get vitamin D hardly from a food source.
Right.
You get a little bit from milk, which came from the cow, which got it from the sun. So, and I always tell patients, unless you are a lifeguard on the equator with your shirt off, most likely your levels are low.
Well, especially
it is something
all the
you need
inside
to
work.
monitor. Like, just don't go out and buy it and start taking it because it's fat soluble. It can potentially build up in your system and you can have a toxicity to it.
Mm-hmm.
So you need to have it monitored and you need to have somebody tell you.
When you say fat soluble, what does that mean exactly?
So it's absorbed best with
Fatty foods,
and it can get absorbed in the lipids of your body, of your cells, so it can build up in the cells.
Mm-hmm.
Okay, water soluble, it's soluble through water. You're going to pee it out, like a B vitamin.
Yeah.
Okay, you're not going to, you can have high levels of B vitamins, but you're not going to overdose on it.
Mm-hmm.
Okay, you're going to pee out what you don't use.
You can actually overdose on vitamin D?
Yes, you can develop pancreatitis. Absolutely.
Sean, parting words of wisdom for anybody that wants to start their own business. Oh, you know what? Hell, I missed something big here that I need to ask you. Facts versus myths. What's the biggest myth about being a nurse practitioner? And I mean, you can rope that into healthcare if you want.
The biggest myth that we got a bunch of money. That ain't true. No.
That deciding on the Ferrari or the Jag.
Yeah. We're not doing that. No. I would say, it's hard, these type of questions. Biggest myth, I don't know. Number one, that I have a doctor that's like over my shoulder watching me all the time and dictates to what I do.
Mm-hmm.
I think that's kind of a myth sometimes that, people say, well, people haven't done this in my practice, but people before, have said, when do I see the doctor? You can go see a doctor, but you're not going to see one here.
Yeah.
I'm a nurse practitioner.
Mm-hmm.
You have to know that.
Yeah.
You need to know that as my patient. You're not seeing a physician. You're seeing a nurse practitioner.
So, and I guess I just live in this bubbled shelter world, but I ask a lot of questions about a lot of things.
Mm-hmm.
And I wouldn't really, I see Affinity Family Care.
Uh-huh.
I know I'm going to walk in the door and I'm going to get some sort of health care.
Uh-huh.
Now, depending on the results of that, I will continue to come or not.
Uh-huh.
That's how I make decisions.
And I'll say the majority of the public are becoming like that. Number one, because there's such a shortage of physicians,
mm-hmm.
most patients have had many encounters with nurse practitioners in all healthcare specialties, the hospital,
sure.
specialty offices, so a lot of that myth, right, that the nurse practitioner is the nurse and doesn't know what they're doing
mm-hmm.
is going away because of the amount of experience the public has had with nurse practitioners, and that's why some of the times you get that lumping together
mm-hmm.
of, well, I don't care what the hell you call yourself, as long as you give me my prescription, take care of me, that's what I care about.
Right.
But that's where some of the confusion can come in,
mm-hmm.
And most of the public doesn't really care,
Right.
But I would never want somebody to think that I was a physician.
Right.
And came and saw me.
And thought they were seeing a physician.
And the whole time thought that they were seeing a physician. I wouldn't want that. I'd want to stop and say, well, wait a minute, let's stop here
Yeah.
Let's correct this.
Mm-hmm.
You know, and if you're uncomfortable with that, there are physicians you can go and see. But there's not one I can call that's going to come in and come see you.
Right.
They're not down the hall collecting the check.
Okay, so parting words of wisdom. What advice would you give to my buddy Joe here that wants to start his own practice?
Okay. First, spend a lot of time with why.
Mm-hmm.
Why do you want to do this?
Is why.
Is why.
Mm-hmm.
Yeah, and if it's financially at the top, don't do it. Don't do it. You know, the finances will be there. You know,
well, that's what
I'm never going to get rich, but you know, can I pay my bills? Yeah. You know, do I make a little bit more than I did when I worked for somebody? Yes, I'm pretty sure I do. You know, like I said, I don't really keep focus too much on that.
I got to ask
anyway.
Blue Cross to make sure.
I got to ask Amanda. You know, but I should. I have more responsibility. I have to run this practice. There's things that I have to do.
Risk.
Right. Whereas
risk.
If I worked for someone during COVID, I can default my brain to someone else.
Right.
All I have to do is come in here and what do you want me to do? Mask today? Yes or no? Okay. Prescribe medicine or not? Okay. Like I don't have to think.
Right.
You know, but when it's me, now I have to make those decisions. So yeah, I think I should make a little bit more than I did when I worked for somebody. It's not substantially more, I'll tell you that. So I would tell Joe, first of all, spend time with your why. Mm-hmm. My why wasn't money. My why was because I wanted the opportunity to take care of the people the way I wanted to take care of them and have that autonomy.
Yeah.
Where I didn't have to work 3 jobs to make it all into one lump. If I need to make more money, I do something else. I add a service. Mm-hmm. You know, I can mold my clinic the way I want, you know?
And, you know, that's been really, watching you grow and offer those additional services has been really, you know, like I come in for my main stuff, you know what I mean? And then, you know, like I'll see something Amanda posts on Facebook or something like that. Hey, well, hold on. What are these IV vitamins, you know, doing now? You know, that's been really awesome to watch your business, not just your practice, but your business grow. Mm-hmm. I always am for a person that wants to start their own business.
Me too.
You know, and it's exciting, even if I don't have any involvement. It's really exciting to see somebody thrive. You know, at least do well. You know what I mean? And there's so many people. Sorry, I keep interrupting you, but there's so many people that are so reluctant to take their chance and to add that risk in their life.
It's not safe.
That they secretly are happy to see somebody fail.
Yep.
You know, and they're the same people that are going to ask for a discount when they go to your store.
One of the best books I ever read, you've probably read it, and if you haven't, I'd recommend it because you'd like it, is Rich Dad, Poor Dad. Yeah. You know, and so that was, I read books like that before starting the business, so I would recommend to Joe to read some of these books, you know, these entrepreneur books.
Think and Grow Rich.
Yep, absolutely. The Compound Effect was another huge one for me, the Compound Effect. So get your why, and then build people around you. You know, get to know people. You know, like I'd be willing to help you, but you're gonna need people. I've had people, Derek, you know, who had his own PT place for a long time. You know, and Angela Mitchell was another, and is still another mentor of mine. She had a practice in Converse for like 16 years. You know, way ahead of me, and could kind of give me some advice, like, hey, you don't want to do that. Trust me. Yeah. You know, so she's been a godsend for me. So you got to get people. Mm-hmm. You know, I knew a woman who I was training at WellMed. She was an NP student. Her husband had an NP practice in long-term care facilities. Mm-hmm. So they would basically drive to these like nursing homes and be their primary in those places. So he had a different paradigm than I did, but he gave me a lot of information about credentialing and things like that. So you got to get people. You can't do it on your own. Mm-hmm. You know, get to know people. Get an accountant. You know, get consult a lawyer. You know, ask questions. Be prepared to work. Yeah. You know, if you're not a worker and you just I want to do that 40 hours and go home, this is not for you. Don't waste your time.
I would argue any business is not for you if you're only.
You've got to be willing to, even when the times get hard and you think to yourself, you know, man, that cruise ship was nice. Uh-huh. I had a scribe. I saw like 8 to 10 patients a day. I had a 401k with all these bells and whistles. I had all this stuff, right? So you get this in your mind. It was so much easier. I could just go back. But then I lose focus of what I'm doing.
Right.
To have patients like you tell me what you told me today, and that's why I do what I do, for that, and so, it goes back to your why. And I forgot who said it, but somebody said this in business, you can always close down tomorrow.
Yep.
Just keep that in mind, one more day.
Yep.
What's one more day? If you want to give it up tomorrow, and tomorrow becomes tomorrow.
Yeah.
And so you gotta focus on that. I think I read something in a Navy SEAL book that I read that he said most of the people that fail when they go to BUD/S training is because they go in there with this idea, I'm gonna pass. I'm gonna make it to the end. I'm not gonna quit. Nothing's gonna make me quit. I'm a man. I'm gonna be a Navy SEAL. I'm not gonna ring that bell. I have to die. But they have no plan.
Right.
That's the plan. I'm gonna do this.
Mm-hmm.
And it's those who go in with the day-to-day plan. How am I going to get there? What am I going to do when I want to go ring that bell?
Right.
Because they all want to ring the bell. What keeps the one stuck and not ringing the bell? It is not willpower. It is not, I'm just more willpower than this guy. It's a plan. It may be a moment, but I'll quit in 10 minutes.
Mm-hmm.
And then that turns into 20 minutes. And that's what he was saying. He was on this road march, and it was like, all right, I want to quit. And there's like 10 miles to go. He would pick a spot on the horizon, like a telephone pole or something. I'm going to run to that telephone pole and it's over. I'm going to quit.
And then you're there.
And he'd get there and it was the next one and the next one. So it's that kind of thing that Joe, I think, would need to really start tying into along with his why, because it ain't easy, especially as a nurse practitioner.
Mm-hmm.
As a doctor, they have medical associations. As soon as I graduate, I can get $1 million loan.
Yeah. Wow.
I tried to get a loan. They was like, you're not a doctor? What?
That's cute.
Yeah, that's pretty much what I had my suit on and my tie, It's like, so you're a what?
Yeah.
You want what? Why don't you show us some numbers first?
Yeah.
That kind of thing.
And just the problem here.
So then you realize, you know what? I've got the numbers now, but now I don't need it.
Yeah.
Well,
we talked about this before when I came to see you for at your practice, and I don't want to be that squeaky wheel, and I know you got shit, and then Amanda had a lot of things coming up. You're Amanda, and I just now's not the right time. I can only imagine the things that were going through your mind. This podcast, I know, was not one of them. But I do appreciate you coming in today, man.
Yeah, it's been a pleasure.
Where can people find you online and in the real world?
We have our website at Affinity Family, affinityfamilies.com.
Mm-hmm.
Then we're in Cibolo there off of Brite Road in 1103. There's that little shopping center next to the Sip Wine Bar.
Mm-hmm.
They're great shout out there for them. So yeah, that's where we're at.
Right on. Yeah, thank you
We're
again.
accepting patients from babies to grandma and grandpa.
Yeah.
Come on by. Happy to take care of you.
Yeah, and I can attest, taking care of you is what he means. Thanks again, Sean.
Yeah, no problem.